Hi, my name is Colby. I'm an occupational therapist and certified hand therapist for WESTARM therapy. Today, I would like to share with you some tips and exercises on how to manage carpal tunnel syndrome. Carpal tunnel syndrome occurs when the median nerve is compressed at the wrist level. This often results in tingling and numbness in your thumb, index, middle finger, and half of the ring finger. The median nerve, shown in yellow, runs through a tightly packed area in the wrist, along with the tendons that flex your fingers and thumb. Activities that require repetitive bending of the wrist, tight gripping, or tight pinching can increase pressure on the nerve. Aim to maintain a neutral wrist and a relaxed grip as often as possible so that the nerve can heal and function properly. Poor ergonomics when using a computer can contribute to symptoms, especially if your wrists are resting over the sharp edge of your keyboard or desk as shown in this video. However, there are many other common activities that may be contributing to your condition, such as prolonged smartphone use, frequent use of power tools and hand tools, and sustained tight gripping. It can be helpful to use ergonomic tools that fit your body well, as well as rearranging your environment so that you're able to keep your wrist in a neutral position throughout your day. Be mindful of the amount of pressure that you're using when you're holding on to tools and objects, and only use the amount of force necessary to complete the task. For instance, when you're driving, try to keep a light grip on the steering wheel rather than squeezing down tightly for long periods of time. If you are doing an activity that requires a lot of repeated bending of the wrist or tight squeezing, it's important to take frequent breaks to bring that wrist into a more relaxed position and to stretch the muscles that bend your fingers down. I'll show you 2 exercises to help with that now. Start with your elbow by your side, palm facing up. Extend your wrist and point your fingers toward the floor while applying gentle overpressure with your other hand as you straighten your elbow. Hold for 20 seconds. If this is too intense, you can perform this stretch with your fingers pointed at the ceiling. Repeat 3 to 5 times. Stop the stretch if you have any increase in tingling or numbness. For the next exercise, you'll need to use your other hand to hold all of your fingers but one in full extension, then gently bend the unrestricted finger at the middle knuckle. Repeat this 10 to 15 times, then move to the next finger. It's important to keep your wrist straight while performing this exercise. What you're doing here is gently gliding or flossing the tendons that bend your fingers one at a time through the carpal tunnel to achieve less friction during active use of your hand. Don't worry if you have trouble bending your small finger, this is common. You can also do this exercise with the tip of your thumb. Sleeping with a splint that keeps your wrist neutral can allow your tissues to rest and heal. This splint was custom made in one of our clinics, but you can also find similar products at your local drugstore. This is certainly not a comprehensive list of ways to manage carpal tunnel syndrome. For exercises and advice specific to you and your condition, please visit one of our 5 facilities that offer occupational therapy.